Good evening, everyone. It's 6:35, March 6, 25. Welcome to Queens Community Board 1, Health and Human Service Committee meeting. My name is Shahinaz Hamdi, and I'm the chair for Health and Human Service Committee. This meeting is recorded for knowledge everyone. And also this one going to be live streaming in YouTube. You can watch it later if you want to take notes or watch it again. To start, I'm going to do the roles for the community members. I'm going to call the name. Please unmute yourself when I call your name. Daniel Alberti. I don't see him. Jean Marie. Dean Fortovic. I also say it's good. Thanks so much. Chris Hanway. Okay. Rosemary. Rod.
Rosemary's trying to come in. She's trying to get in on her phone.
Thanks a lot. Rod.
I'm here.
Good evening. Hi, Rod. Judy. Not here. And Rosemary Yelton. Okay. There we did the role. Right now, I have also from the community board, the Canola. Anyone else from the community board wanted, it's here? Besides Canola?
Todd Schultz is here.
Todd, thanks so much, Todd. Nice to meet you again. Okay, today our agenda will be including a presentation from Live in New York. They are organization for Save Life, providing comfort and strength leisure through organ, eye, and tissue donation. We have today with us Raida Hussein. She's going to give us a presentation. If you want to ask a question, you can raise your hand. And remember again, this is recorded and live streaming in YouTube. Raida, you can start and you can share your screen and introduce yourself first, please. Raida, you are muted.
Sorry. Hi. Yes. Thank you so much for introducing me. I apologize in advance if there's like a delay issue, a lag with my audio. I think I might not have the best connection right now, but I will proceed. So yes, my name is Raida Hussein. I am the Queens Community and Government Affairs Liaison for Live on New York, which is a nonprofit that handles organ donation in the greater New York City area. Before joining Live on New York, I was Chief of Staff for Assemblyman David Wepring. I was with, Senator Toby Ann Stavisky and Congresswoman Grace Meng. So I've been all over Queens, and I'm happy to be here tonight. I actually think that Queens Community Board 1, our office is located in Long Island City. I think we're not too far from your headquarters. So it's good to be here tonight. And without further ado, I will start to share my screen and give you my PowerPoint. Okay, do you see? All right.
Yes, can you make it in yes.
Yeah, slideshow mode.
That's correct.
Yeah. Okay, all right. So I'm about organ, eye, and tissue donation. So Live on New York's mission is to save lives, provide comfort, and strengthen legacies through organ, eye, and tissue donation. And we do this by working with multiple partners and performing multiple tasks. We go out to educate the community about the power of donation. So thank you for allowing this, for having this for a platform to talk about organ donation. We advocate on behalf of those who are waiting for a transplant. We also partner with local hospitals and transplant centers to deliver the gift of life. We handle all the behind the scenes logistics of actually getting these organs and tissues to the people who need them for their transplant surgeries. And we provide care for the families of organ donor heroes who selflessly give that gift of life. This is our DSA, Donor Service Area, also known as Designated Service Area. So this is a DSA that consists of the 5 boroughs, Nassau and Suffolk, as well as the Lower Hudson Valley. So this is a population that includes more than 13 million people, 11 transplant centers, 200 hospitals, and we are out there every day coordinating with hospitals and with individuals about organ donation. To give a little overview on the general organ donation process in the United States, there are 55 organ program organizations, OPOs, and those are the organizations that are designated by the federal government. So every time a hospital, there's a certain criteria met where organ donation can happen, hospitals are legally obligated to call their local organ procurement organization. So the New York City metropolitan area, that we live on New York. And so that's the organ procurement organization is the team that recovers these organ and tissues. We are regulated by the Centers for Medicaid and Medicare and Medicaid Services. And so yeah, we're actually we're very busy as an organization because there are 4 throughout all of New York State, and Live on New York handles the bulk of the downstate need for organ donation and transplantation. It starts with a hero. The organ donation happens, specifically, I'm talking about donation, it happens with a donor hero. So I have before you 3 donor heroes, people who are heroes in both life and death. And so I'll be sharing their stories. The first story is of Detective Wilbert Mora. In 2022, he and his partner, Officer Jason Rivera, were tragically shot during a domestic violence call. Officer Mora was a hero not just in life, but in death as well. He was able to save 5 lives through the donation of his organs. And so he continued, he left a legacy as a hero. And this is a story that gained that this officer died in the line of fire, on duty, answering a domestic violence call, and also saving lives through, additionally, through the donation of his vital organs. We've worked with the NYPD to steward his legacy. So this is an example of his heroism. The second person I'm going to introduce is firefighter William Moon. In 2023, he died during an FDNY training exercise. And he was able to donate organs, including to fellow firefighters, including a firefighter who needed his heart, someone who needed lungs after having served during 9/11. And his widow, Christina Moon, is a staunch advocate for organ donation. And very recently, his children were able to listen to their father's heart inside the person who received firefighter Moon's heart. So that was a meeting that we were glad to facilitate. And finally, I have Roger Kwok, who's with the Department of Sanitation of New York. Roger Kwok, so he's another hero, and his brother Stephen Kwok has spoken about how losing his brother was a tragic event, but he feels gratified knowing that his brother was able to die through organ donation. So we worked with the FDNY, we worked with the NYPD, we worked with all sorts of institutions to really promote the stories of these organ donor heroes. As I mentioned before, Live on New York handles deceased donation. I'll mention living donation in another segment. But to clarify, organ donation only happens when a patient dies in a hospital and has been declared dead by a doctor. Candidates for donation must have been placed on a ventilator prior to death or have died while on a ventilator. And the reason for this specific requirement, and it often surprises people, is that when you die in any other manner, your organs experience what is called ischemic injury. Basically, your heart is no longer pumping blood. Your organs are no longer receiving oxygen, so they're experiencing this damage, and they are no longer in a position where they can be recovered and transplanted. However, when you are on a ventilator at time of death, again, you're not producing your own functions. Okay, you're dead. Like, you have the ventilators there, but basically when you're still on ventilated support, so your organs are receiving oxygen and they are in a position where they can be recovered. So only 1% of the population dies in this very specific manner. And that's why, even though so many people have signed up as organ donors, like at the DMV, for example, we still have this shortage of organs, and we still have wait because the very specific manner where an organ can be transplanted and recovered. Otherwise, there's really no transplantation can't happen. Other times, if you do die in other ways, there's a possibility for tissue to still be recovered, but your family have to contact the coroner as soon as possible. Extensive testing is done to make sure that the organs are healthy, to identify a matching recipient, and a patient had either signed up as a donor, or authorization by a legitimate third party must be granted. So even if someone had not signed up as an organ donor prior to death, donation is still possible. And this slide has a list in hierarchical order of who has the authorization to make that donation. It's interesting. Throughout the rest of the country, like 75% of donations in the local area are from like first person authorization, and then 25% comes from like third party authorization. But for our designated service area, that's actually flipped, where most of the authorizations come from family members. And that's why it's so important for us to have our family support advocates who are there talking to the families through the process of organ donation. We have family support advocates who provide linguistically and culturally sensitive support, addressing the diverse needs of New York City's families and walking them through this process. The gift of life. Nearly 9,000 New Yorkers are waiting for a life-saving organ transplant. And as I mentioned earlier, Live on New York does handle the bulk of the need for a transplant in the New York State area. 8% of those waiting in New York live within our designated service area. The number one need is kidney, then the liver, then heart, then lungs. One organ donor can save up to 8 lives through the donation of vital organs, such as the heart, the lungs, the liver, and intestine, and they can enhance up to 75 lives through tissue donation. So often, even if a person is not able to donate organs, there's still a possibility that they can donate tissue. So we work with the eye bank, for example, for cornea, for people with macular degenerative disease, tendons, heart valves, veins, skin grafts for people who need reconstructive surgery, like reconstructive breast surgery after getting mastectomies, or for burn victims, and bones, of course. So living donation, that is handled through a transplant center. If someone wants to donate to a family member, a friend, or even to a total stranger, they can donate like their kidney, lobe of the liver, part of an intestine. So yeah, they can choose who receives their organs, and oftentimes there's improved outcomes. For example, living kidney donations often fare better than deceased kidney donations. So there's the concept of paired donations where you may not be able to donate to your family member or to your friend. There's incompatibility issues, but you can find another pair, someone who's waiting for a kidney and someone who also wants to donate to that person, but it is incompatible. And then you can sort of, and it's like a chain. And again, living donation is handled directly through transplant centers. Only after extensive testing is done to ensure healthy outcomes. And the New York State Living Donor Support Act, that was signed by Governor Hochul, I believe in 2023, does allow reimbursement for costs not covered by insurance. So like the time that you take off from, having surgery and then recovering from that, living donors do get reimbursement for all that. So the process for getting a transplant is very thorough and extensive. First, a doctor refers the patient, if the doctor feels that the patient would be a good candidate, to the transplant center. The transplant center gathers information. They book an evaluation appointment, and they do the medical evaluation. They do the psychosocial evaluation. If the transplant centers if they deem that the patient will be a suitable candidate, then that person is added to the national transplant waiting list. And the reason why this is such a thorough process is because they want to make sure that the person receiving a transplant will be able to do everything possible to preserve that organ. Because when you receive your transplant surgery, your life is forever changed. You're expected to take immunosuppressant medication every day for the rest of your life. Otherwise, the body will reject the foreign organ that is inside you. You're going to be expected to follow doctor's orders, go to your appointments regularly, take medication, follow a diet and exercise regimen, basically do whatever you can to preserve your health. You're expected, can you take time off from work? Do you have a strong social support? Transportation to get to your appointments? And because, again, there's this shortage of available organs, they want to make sure that like an organ is, to say it bluntly, not wasted. So yeah, so you are expected to be able to, follow all these strict guidelines once you get your transplant. Multiple factors are considered when matching an organ to a patient. So compatible blood and tissue types. Same thing with like blood donation. Making the matches between the AB blood types. Body mass is an important factor. For example, a child on the transplant waiting list would need an appropriately sized smaller organ for their body mass. Rank on the national transplant waiting list, as well as geographic proximity between the donor and the recipient. Organs only last for a short amount of time outside of the body. Kidney lasts for up to 3 days. Hearts can last up to 6 hours. Time is of the essence. So that's why geographic proximity is an important factor. Information gathered from medical tests are used to identify the best match for the transplant waiting list. And it is illegal to make organ donation matches based on race, gender, religion, and social or celebrity status. So if Kim Kardashian wants an organ, for example, if she needs one, then she'd have to wait like everybody else. She wouldn't be able to buy her way up the list. Once you're placed on a national transplant waiting list, you are given a unique identifier. And only the factors I mentioned, like again, compatible blood and tissue types, mass, how long you've been sick, geographic proximity, those are the factors that determine your rank on the list. To clarify, Live on New York does not handle who gets placed on the national transplant waiting list. That's handled by the Organ Procurement and Transplantation Network. So, and they are the ones who maintain that waiting list for the 100,000 people who are waiting for a transplant across the entire United States. I'd like to share an example of a transplant recipient, Roxanne Watson, who received a heart from 23-year-old Michael Bovell. He was on the U.S. Coast Guard. He tragically was killed in a motorcycle accident in 2010. His parents knew that he wanted to be a donor. Michael was just such a caring and compassionate guy. He did everything he could to help others. So, when the time came, his parents said yes to donation. And by the time that Roxanne had received her heart transplant, she was basically on death's door. Like performing the most basic functions, bedridden and not able to do any of the things that we take for granted. So since she's received her transplant, she has, as it says here, broken world records for registering people as donors. More than 12,000 organ donors across New York State. She has a radio show. She's like everywhere. Tabling, like she's a real, a staunch advocate because of how organ donation transformed her life, and she's committed to honoring Michael's legacy. We need action. Only 50% of New Yorkers are registered organ donors. Previously, we had been ranked dead last in the compared to other states in terms of organ donation registration. That's since been reconfigured, but we're in the middle of the pack, but it's still not great. Like other states have like 60% of like eligible people who are eligible to become registered as donors who are actually registered. But unfortunately, the low registration rate has led to an organ shortage. Due to the shortage, people in New York State who need transplants wait longer. For example, the wait for a kidney can be up to 3 to 5 years, typically across the U.S. But in New York, that wait can be 5 to 7 years. On average, New Yorker on the transplant waiting list will die every day. So the best way to sign up as a donor is to enroll with the New York State Donate Life Registry. The most common way that people sign up as organ donors is at the DMV. You check off the little box. You have the heart on your license. I'm sure some of you already have that. But there's all other platforms to register as organ donors. You can register as an organ donor when you are signing up for the volunteer, the voter registration form. We Live on New York volunteers. We work with civic organizations at voter registration drives because the voter registration form and the organ donor enrollment form are in the same form. When you're signing the NYC, when you're buying health insurance through the New York State of Health Plan Marketplace, or you can just do so online. There are multiple ways to sign up, and they all lead you to being on the same registry. I compiled a little data on Community Board 1. So I think these were the zip codes that I Googled that I think fall within your community board. I'm not going to go through like every detail of this, but you can see like the number of people, by zip code who are waiting. This is like 2023 data because it takes time for us to get like the first like quarter Q1 of 2024 data. But as you can see, there are more people who receive organs than there are, more candidates than there are recipients. And donors, like as I mentioned before, not everyone who dies and has signed up as an organ donor becomes a donor because of circumstances. So some zip codes, no one died and became a donor. Like only a couple, like 1103, 1106, and 1370 were able to donate organs. Okay, and then my final segment is true or false. Organ donation has a ton of urban legends. I'm sure you've heard of many of them. They're like the plot points of all these different like soap operas. And they're presented in the most sensationalistic, unrealistic manner. So I'm here to like debunk a lot of these urban legends, these myths and misconceptions. True or false? Doctors will try as hard to save me if I sign up to be an organ donor. Okay, the truth is everybody in the hospital, doctors, nurses, EMTs, they do everything that they can to save your life. That is their legal obligation. That is their ethical obligation. No one's going to be fishing in your pocket saying, you know, when you're put in the OR, oh, she has a heart on her driver's license. You know, we're just going to we're going to take her organs. That does not happen. Your quality of medical care is never compromised. You still receive the best treatment possible. And the doctors who treat patients, they're not the same as the team who handle organ, eye, and tissue recovery. So there's no conflict of interest there. True or false? Organ donation is against my religion. The truth is, major religions celebrate organ donation as a way to save lives. I'm talking, you know, Buddhism, Judaism, Christianity, Islam, Hinduism, Catholicism, Sikhism. Organ donation is seen as, you know, a final act of kindness and generosity. Live On New York works with clergy across all religious denominations and religious faiths in New York City, again, reflecting the diversity of the city. We talk about how support for organ donation can be found within different scriptures. And we do always, we do education outreach to chaplains and hospitals, to houses of worship, and you know, public outreach, you know, events celebrating you know, religion and organ donation. But we always do encourage people to reach out to their trusted faith leader if they have any questions. True or false? I'm too old, I'm too sick to be an organ donor. The truth is, there's no age limit for organ, eye, and tissue donation. The oldest donor recorded in New York State was 93 years old. They have been able to recover organs from people in their 90s at the time of death. That's amazing. And so people will frequently tell me when I'm tabling an event, like, oh, you know, I'm too sick. I'd love to be an organ donor. I want my used up like old like organs. And I tell them, no, don't discount yourself. Please sign up. You know, there's no medical requirement in order to be a registered organ, eye, and tissue donor. Again, medical history is always reviewed at time of donation to determine potential matches and needs. And we're able to work around certain conditions. Hepatitis C is not like rule out. Some hepatitis C donors have had positive donors have had their organs transplanted. And in 2013, President Obama signed the HOPE Act. And that act allowed people on the transplant waiting list who are HIV positive to receive organs from HIV positive donors. So again, we're able to work around a lot of issues to make donation happen. True or false? I will be able to have the funeral that I want. This is false. Organ, eye, and tissue recovery for donation are very serious surgical procedures. They're done with the utmost care and respect. Open casket viewing is still possible. Once the team has recovered, you know, organ and tissue, the body is returned to the family, and we work with families' timelines for burial, and we make sure that they're able to have, you know, observe the funeral choices that they wish to have. Oh, I'm sorry, I forgot to mention one other thing. Families are also never responsible for any of the costs relating to donation. That's always handled by the local organ procurement organization. So in the New York City metropolitan area, that's Live On New York, and then the respective organ procurement organizations in whatever state or designated service area. True or false? I want to be an organ donor. The answer is true. I hope that, well, at least I hope you'll consider signing a donor. And we encourage people to, again, have this conversation with your family or loved one. This is definitely, it's not the most comfortable topic, but it's very important in case that situation ever pops up. And they should, in general, you know, they should always know your end of life wishes. I don't have a QR code, but I can drop the Live On New York website, you know, in the chat, so that people can sign up as donors there. And thank you again. For more information, please visit liveonnewyork.org. And I'm going to stop sharing my screen. Do people have any questions?
Oh, it's really informative, a lot of information. Okay, Raida, thanks a lot.
I know, there's so much. Yeah.
Yeah, I was like listening is a lot of information. Like,
Yeah.
I have a question. First, I want to share with all of you. My brother-in-law, he received a kidney, and it saved his life. Yeah, after 10 years, it's get filler again. They gave him again, but the problem, his body didn't accept it. He's still now in dialysis, but he got saved his life. Like, this is true. My question now, you said like if the hospital in your region, they will call you first, like call the organization, because you have many organizations for donation. That's right?
Yeah, that is still the federal law. Hospitals are obligated to call their local organ procurement organization, OPO, the nonprofit that handles organ donation in their states, when a certain set of like criteria has been met for organ donation to happen. So yeah, we're like the first line. Like every hospital, they call us within the New York City area. Yeah.
Yes. And my second question now, for example, I'm not from New York, and I have an accident now in New York, and is the person now donate their body to New York, or they have to move it to the state? I'm a donor, and I'm not from, example, from Pennsylvania, but I have the accident in New York, and I die in the hospital in New York. Is the donation go to New Yorker, or
right? I think in those cases, that's a good question. I think it's I'd actually have to double check. I mean, I know that they're able to hospital personnel are able to access the registries of other states. So if you sign up in Pennsylvania, state hospital staff should be able to at some point access the Pennsylvania registry. But I'm not sure about. I think that I would like the priority would be for people within the local area that the organ procurement organization operates in. And there are certain times where we can't find a match in New York State, because again, the specific nature of the organ there may not be someone in the New York State waiting list who qualifies for that organ. So we have like occasionally sent organs and tissues to other states to someone who did qualify as a match. But obviously our priority as in Live on New York, operating in the New York City metropolitan area, is that we have to serve like New Yorkers who are waiting on that transplant list.
Okay, I will give a chance first to everyone to ask a question, and in the end, if no one question, we can ask more. Thanks so much. Anyone, please, from the community board want to have a question? Okay.
Oh, Quinella, I think.
Hi. What is do you keep track of the racial demographics that that are donating and those that are lagging?
Hi, yes, that's a great question. I actually do have slides that I didn't include them tonight, but I do have additional slides that include racial demographics. And so I'll send that over when I send over a copy of the of those slides. But yeah, so basically people of color are the majority on the transplant waiting list in New York City. And they're also the majority of recipients. We've definitely, we understand that many communities of color are concerned about fairness and equity within, receiving transplants. And so we emphasize the fact that, again, there's no inequity in terms of who is on the transplant waiting list, who finally gets an organ, and who are the donors. So yeah, as I mentioned, people of color, the majority on the transplant waiting list in the New York City area, and they are the majority of the recipients. And while organ donation obviously can happen between people of different racial and ethnic groups, we do encourage, it's positive to have a
Raida, we lost you. I believe she's frozen. Okay, we'll wait for her. Give her a few. Sorry, everyone. Technical issue can happen anytime. We give her a few. Maybe she will be logged out and come in and back. Yeah. Okay, she's back.
Hi, sorry about that. Yeah, I'm sorry, the lagging connection. But yeah, that was a great question. And in the I will have that data for you in the when I send over the PDF copy of tonight's PowerPoint presentation. Thank you for asking that.
Anyone?
Does anyone else? Oh, sorry.
That's okay. Anyone else have a question?
Yeah.
I have another question.
Go, Canella.
Mhm.
Sorry. Do you go out to different communities in like in Community Board 1 and other communities to do this type of presentation? Because I think it would be very helpful.
Yes, that's a good question. So I handle Queens. So anything within the Queens area, I do that. I have colleagues who handle Brooklyn, the Bronx, Staten Island, Nassau and Suffolk, Manhattan. But yeah, I specifically do Queens-based engagements, and I have other colleagues who handle community-based engagements. So we have colleagues who handle the the Jewish community, the South Asian community, an interfaith liaison who speaks to groups across all different sorts of faith backgrounds. So yeah, but like anything Queens based, I'm the person to contact. But if you have an idea for something outside Queens, then I can refer you to my other colleagues who would handle that.
Thank you, Canella. I was going to ask a question. Thank you. Yeah, if you can also, when you send the information, can you share with us your contact? This way, if someone want to call you and schedule like a workshop with you.
Okay, yeah, I will share my I'll send a follow-up email and then share my contact information. And I believe that Canella, thank you. Canella has another question.
Yes, nobody else is asking, so I want to
Yeah,
ask.
totally fine, totally fine.
Okay, what about bone marrow donation? Do you handle that type of donation as well?
That's a good question. So bone marrow, we do not handle. There's another organization that does that. I believe it was called Be the Match, but they must have changed their name recently. Yes, it's National Marrow Donor Program. All right, so we don't handle bone marrow. That's a separate organization.
Can you repeat the name, please?
National Marrow Donor Program. Let me if I have chat access. Yeah, let's see. Yeah, so that's the organization that handles bone marrow.
Yeah, because that might be an organization you may want to invite as well, Shahnaz.
Maybe Florence, maybe you can put it in your list, please. Like if
I already have it.
it's a lot.
Yeah, so sorry. Yeah, I mean, thank you again for all your great questions. And again, if you're posting any kind of community fair, health fair, resource fair, I'd love to be there. Community Board 1. Yeah. Again, I think that is our where we reside. I think so. I'd love to do more engagement with that. Yeah.
Okay. Anyone else? Kunala, if you have any more questions, go ahead. Don't worry. I'm happy when I hear people ask a question.
Sorry, this was a great presentation because I am not a donor of, I did not check that on my license. And your presentation is making me rethink it. So do you also keep your metrics on when you go out and do presentations? How many, people have signed up? Like if you go out to like, say, low income areas where I'm sure it's probably a low number of those folks that sign up as donors. If you keep metrics on the presentation and how many people signed up for it or changed their minds about it.
Yeah, that's definitely that's something that we do catalog. How many people we register. We often find that many people, many people had already registered before these presentations at the DMV, just checking off the box, and they'll probably show off the heart on their licenses. Or for many people, for others who haven't signed up yet, they say, okay, I hear what you're saying. This is really like similar to what you were saying, like this is great information, but I need to think about it, and I definitely need to talk to my family and friends. And so we think, that is the reasonable choice. Think about it, and whatever decision you make, please tell your family and friends about that. But yeah, I've had like a receptive message, people saying like positive things, like, wow, this really did reassure me, and I'm glad to know that this is something that could help people in my community. Like so many people on dialysis who need that kidney, so many people with heart failure, cardiomyopathy, who need the heart with cirrhosis, who need livers. Like there's just so many different conditions like for organ failure. And it's someone like these people are waiting for the phone call where they'll be told, we found the heart and now you're going to get the surgery, something like that. Yeah, absolutely. All right, anything else?
Anyone? Tokonella, get your time. Ask a question. This is the best.
Thank you, because some of the stuff that you had on there, I was thinking the same thing, like, about the religious part, about, people skipping the list and people going into hospitals and you're purposely killing them so you can save 8 lives. So I did think about those things were, in the back of my mind. And I was like, I don't want to do it because of that. But
no, it's great. Like that's why I'm glad to be able to speak with you. Like there are a million different misconceptions, and obviously I can understand how this can be like a scary process, something scary to think about. But it's like just learn and keep an open mind and hear the facts and learn about how it really works. That you're not going to wake up in a bathtub with both of your kidneys taken out. Like that's not how it works here.
Okay, this might be a silly question, but what about pet donations?
No, that's actually a good question because we handle human donation. But yeah, there have been instances, and I was just doing research on this, where cats can get kidney failure too. So there have been instances where someone with a cat with kidney failure will adopt another cat, and that cat will the second cat, the cat that was adopted, that their kidney can then be transplanted into the first cat with kidney failure. So a number of veterinarians have experimented. I think it's a new procedure, but yeah, that's pet donation. Getting a living cat kidney donor for a cat with kidney failure. That's but it's a very specific set of circumstances.
Winella is no silly question.
No, that was actually that's an interesting topic.
Really good.
Is there something analogous for pets? Yeah, that was good. Yeah.
My question, you said only when the people die, you will be able to receive the donation. What happened with liver? I know liver, you can donate it when you are alive. You have people in list for this also?
Yeah, so you can donate a lobe of your liver. We don't handle living donation. So if someone wants to donate a lobe of their liver to, again, a family member, a friend, or that would be handled through the transplant center. So whatever, local transplant center. To clarify, there are, again, 200 hospitals within the New York City area, but not every hospital has a transplant center. Transplantation is a very specific form of surgery, highly regulated, very specialized. So in our designated service area, as I mentioned, 200 hospitals that we work with to recover tissue and organs, but only 11 transplant centers located at different hospitals that handle organ or transplant surgeries. Because again, transplant surgery is so Shauna, it's a very specific, highly specialized, highly technical surgery. So not every hospital performs transplant surgeries, and only a select number of hospitals will have the transplant centers where they have qualified surgeons who can handle that extremely, again, highly technical, very difficult surgery. Yeah.
Yes, I remember my brother stayed how many hours in the room? More than hours. Yes.
Yeah.
What was my other question? Yeah. Does people, when they they don't want to donate, they put any condition, not condition, they say it I don't want to give this to people maybe out of the state. I don't want to give this to someone the people has any they can say what they need after they die, or just only if you want to donate, just donate?
Yeah, so there are certain forms that you can fill out where you can specify, I don't want to have certain organs donated. I'm okay with having my heart donated, but I don't want to have my cornea taken out. So certain forms, you're able to specify which organs and tissue you want to have donated. Sorry, I'm blanking out. So there's or you can say, okay, I want my organs transplanted, but I'm not okay with research. So I'm only going to consent to having my organs transplanted in another person who needs them, but not with general research on how, on the process. So, and some people are like, transplant and research are both okay with me. So sometimes people do have very specific desires for like which organs are transplanted or whether they want the organs to be transplanted or are available for research. So like again, very specific requests for what happens to your organs after your death.
Thanks a lot. That's really good.
Mm-hmm.
Anyone else has any question? Any comment? Okay. Todd?
I just wanted to say thank you for what you do. I interface with the Live On crew a lot at the hospital, and I really appreciate the work that everybody there does.
Oh, thank you. Which hospital are you with, if you don't mind me asking?
Yeah, no worries. Bellevue.
Bellevue. Okay. Yeah. Because I'm not based in Manhattan, I haven't been to Bellevue, but like, yeah, I know that you guys, like, again, we work with you very, like, I hear Bellevue's name quite regularly. So, wow. Thank you. Yes.
Absolutely.
Mhm. All right. So if there are no other questions, no, and again, I really appreciate your like thoughtful, like interesting, like engaging questions. That means a lot.
I have one more.
Oh, yes.
What brought you to this type of work? Like, what inspired you to do this type of work?
Yeah. So again, another good question, because I personally don't have a medical background. As I mentioned before, I was involved in the world of Queens politics, with Assemblyman Wetbrand and Senator Stavisky and Congresswoman Grace Meng. But yeah, I saw that this job opening was listed. And I thought, okay, this is, it's interesting. It's still community based. Like I was hired on the basis of my connections with Queens community institutions and the layout of like the Queens, like, political and social community landscape. But it's definitely interesting to see like the medical side. Again, don't have a medical background. I don't have like a clinical background, but like to understand, the science of organ donation, like the innovations, the need for it, there's the scientific, like the medical side, but also like the social side, like who's getting the transplants and who's not. And also like like again, the fact that this is a surgery, this is a procedure that has only been around since 1954 officially. Like the first kidney transplant was done between identical twins, right? Because they weren't sure about compatibility of immune systems yet. They probably didn't have like the immunosuppressant medications necessary or like the technology to test compatible immune systems. And but like even now, like almost a good 70 years later, we're still doing innovations. For example, xenotransplantation. That's like the idea of like pig kidneys and pig hearts. You may have read about that. And so the idea is that genetically engineered pigs, whose bodies are designed, like their organs are meant to be compatible with the human body. Those organs are transplanted into people who need them. And again, like human organs are just in there's such a shortage. Like it's been seen like, okay, maybe we can do pig, and it's just like how it works out that pigs are the most compatible. I know that like, again, many religions prohibit like pork consumption, but it's just the pigs just happen to be the most compatible animal with the human body. Or like the idea of 3D printing your organs, taking cells and then like trying to reconstruct a heart with your own DNA. Again, that's very science fiction. We're still a long way from that, but like there's just so much research and innovation being invested into this field. So it's just fascinating for me to learn from someone who doesn't have a medical or science background.
Thank you.
Mm-hmm.
Thank you, Kunella. Thank you, Raida. And please, if you can send your information this way, we can take it from Florence and the presentation with the paper for the gomographic. Thanks a lot. And thank you for all your hard work you do it for the community.
And thank you again for taking the time out of your busy schedule to listen to me tonight and for all your very thoughtful and engaging questions. It was truly a pleasure.
Thanks a lot. Have a good night.
Thank you.
Thanks.
Good night.
Good night.
Oh, okay. Now, anyone have a new business or old business want to talk about it?
I'll let you know as more things come past my desk like this, I'll share them with you.
Thanks a lot, Florence. Yeah, that was really good. Thanks so much, Florence. It was really good presentation and informative because as Cornelia said, a lot of us feeling is like, oh, if I have this in my, you're very welcome, Rod. If I have this in my DMV license, they will, when I go to an emergency and they will not treat me the same as like if I not have this donation. A lot of people are scared from this. And I believe this is because it's word of mouth. People like they say to each other, people get scared. And as my brother-in-law who really survived because of the donation, the transplant for the kidney, I believe this is really important for everyone. Thank you, Todd. Okay. Anyone want to bring it to any attention, like for old or new business? Or what, like as the Cornell today asked for another presentation and the Florence has the information. If anyone, please, you feeling like want us to bring any speaker for any kind of, it's not only health, so we have immigration also. If you want to bring it for immigration or is this kind of presentation, please email to me and Florence and Evie. This way we can, Florence can help us to get the speaker and we educate us and educate the community, since is in live streaming in YouTube and you can watch it anytime and people can watch it in YouTube too. Okay, as this, we say thank you to everyone. It was really easy meeting, fast meeting. Thanks a lot and enjoy the rest of the night. And
You guys.
you
Thank
too.
you.
Thanks a lot.
Thank you.
Thank you, Florence. Thank you, everyone. Have a good night.
Have a good night.
Have a great night.
You too, Todd. Thank you on Rod. Thank you.
Brief Studios, thank you very much. We can close the meeting. Have a wonderful evening and thank you for your service.